Namaste. From this channel, along with video series on Ayurveda medical education, we will be starting another video series on interpretation of laboratory investigation. I am Dr. Mahesh Hirulal, Associate Professor, STM College of Ayurveda, Hassan. In this video, we will discuss about complete blood count and its interpretation. In this video series, we will discuss on different investigations related to hematology, serology, biochemistry, and microbiology. These videos will help to the students, teachers, and practitioners. Teachers can use these videos as a pre-lectures and for the practical. Kindly like, comment, and share these videos in students, teachers, and practitioner community and subscribe to the channel. It is general rule that before ordering any investigation, a physician should take the thorough history of a patient, do the complete examination of the patient, and should have some differential diagnosis and probable diagnosis. Then he should advise or order for investigations. Investigations will help to confirm the diagnosis. They will help to decide the prognosis of the condition. Investigations can be used to choose the different treatment protocols. The investigations will help to see that what is the response of given treatment. CBC, complete blood count, also called as hemogram, is the most commonly used investigation. An automated hematology analyzer is used in this investigation. Blood contains plasma and blood cells. This is the quantitative test used to study RBC, WBC, and platelets. In RBC studies, HB, RBC count, hematocrit, MCV, MCH, MCHC, and RDWs were studied. In WBC, total counts and the differential counts were studied, and the platelets were counted in this investigation. CBC is used to assess the general health of a person. If the symptoms of anemia and the infections are seen, then the CBC is ordered. To diagnose the cases of bleeding and clotting disorders, inflammatory disorders, and the immune disorders, the CBC will help. CBC is used to monitor the different health and the disease condition, and it is used to see the effect of certain treatments. This is normal reference ranges of the CBC in the adults. The CBC ranges may differ from laboratory to the laboratory and according to the medical reference agencies. These are the components of RBC study in the CBC. Out of these components, some are calculated values and some are estimated values. Hemoglobin is the most important protein particle present on RBC cells. It will carry the oxygen. Hemoglobin is a general indicator of anemia and polycythemia. Merely increase or decrease in HB will not give the complete information of the diagnosis of RBC disorders, for which the HB estimation has to be used along with the different parameters of RBC studies in CBC. The RBC count is the total number of red blood cells in the given volume of the blood. Increase or decrease in the number of RBC suggests that increased or decreased production of RBC and increased destruction of RBC. Hematocrit is the portion of blood volume occupied by the red blood cells and is expressed in percentage. There are many conditions where the hematocrit value will be decreased or increased. The word PCV is used synonymously with hematocrit, but there is a small difference between hematocrit and the PCV. PCV is estimated after the centrifuge of the blood. Hematocrit is the value given by the automated analyzer. Red cell indices are the most important component of CBC, which will help to pinpoint the diagnosis and gives the more information about the health of RBC. MCV, MCH, MCHC, and the RDWs are used to make the differential diagnosis and they classify the different disorders of the RBC. Mean corpuscular volume MCV is the most important parameter to classify the different type of anemia. It will represent the average volume of red blood cell. It is measured in femtoliter. The normal range is 80 to 100 femtoliter. Mean corpuscular hemoglobin MCH is the average amount of hemoglobin per red blood cell and is expressed in picogram. Mean corpuscular hemoglobin concentration MCHC indicates the average concentration of hemoglobin in a given volume of red blood cells. Red cell distribution width RDW is a very important parameter which will measure the variation in the size of red blood cells. The red blood cells in a population may be microcytic, macrocytic, there may be the matured and the immature cells that will be measured with the RDW. The RDW will help to diagnose the mixed type of anemia. There are different versions of definition of anemia. Decrease in healthy RBCs leading for reduced oxygen delivery is in generally called as anemia. In this condition, reduced HB, reduced count of RBC, and reduced hematocrit can be seen. Nutritional deficiencies are the major cause for anemia. Iron deficiency, folic acid, and the vitamin B12 deficiencies are the major causes for anemia. Severe external or the internal blood loss, increased destruction of RBC will lead to the anemia. Infective or decreased production of RBCs will lead to the anemia. Certain drugs, radiation, and chronic infections will lead to the anemia. Most of the times, patient of anemia may not show the specific symptoms of anemia. He may show the generalized symptoms like the fatigue, headache, breathlessness. If the anemia is severe, then he may show the breathlessness, intermittent claudication, and palpitations. Physician should do the thorough examination of patient and should elicitate the signs of anemia like the pallor, tachycardia, murmur, and the signs of malnourishment. In CBC report, first see the HB estimation. If the HB is decreased, then the MCV is used to categorize the anemia. If the MCV is decreased less than 80 femtoliter, then it is called as microcytic anemia. If it is between 80 to 100 femtoliter, then it is called as normocytic anemia. If the MCV is more than 100, then it is called as macrocytic anemia. This is the first step to pinpoint the diagnosis. If HB and MCV are decreased, then it is called as microcytic anemia. And most common causes for microcytic anemia are iron deficiency anemia, anemia of chronic diseases, alpha and beta thalassemia, and a rare condition of sideroblastic defects. Iron deficiency anemia is the most common cause for microcytic anemia, where HB and MCV will be decreased. The RDW increased in most of the cases of iron deficiency anemia. The iron deficiency anemia can be confirmed with the further tests like serum ferritin, serum iron, ferritin to iron saturation, and TIBC. Other causes of microcytic anemia like alpha and beta thalassemia can be confirmed with the HB electrophoresis and bone marrow biopsy, and evaluation of systemic chronic health status has to be done to confirm the microcytic anemia due to the chronic health issues. If HB is decreased and MCV is increased, then it is considered as macrocytic anemia. There are two scenarios in macrocytic anemia. One is megaloblastic anemia and another one is non-megaloblastic anemia. Vitamin B12 and the folic acid deficiencies will lead for megaloblastic macrocytic anemia. Some specific drugs will induce the macrocytic anemia. Alcoholism, hypothyroidism, and pregnancy will lead for non-megaloblastic macrocytic anemia. The peripheral smear is used to differentiate megaloblastic and non-megaloblastic anemia. In megaloblastic anemia, immature large RBCs with the hypersegmented neutrophils are seen. Serum homocysteine and serum methylmalonic acid tests are used to differentiate between vitamin B12 deficiency and folate deficiency. If HB is decreased and MCV is normal, then it is considered as normocytic anemia. The causes for normocytic anemias are acute blood loss, hemolytic anemia, aplastic anemia, and renal insufficiencies. Then observe for the RBC count and hematocrit. To evaluate the normocytic anemia, the reticulocyte counts, stool for occult blood, LDH, unconjugated bilirubin, and Coombs test can be used to pinpoint the diagnosis. Different hereditary and acquired causes for hemolysis has to be assessed in normocytic anemia. CBC is a quantitative test and peripheral smear is the qualitative test. Both these tests should go in hand by hand to make the precise diagnosis. In this series, in next video, we will discuss on WBC and platelet studies with peripheral smear. In medical education series, we will discuss on CBD, DOPS and MCX. Thank you for watching this video. Kindly share the video to the different communities and subscribe to the channel. Thank you.